I'm also Dlova. I'm a skin specialist and head of department at the Nelson R. Mandela School of Medicine in UKZN. I'm also the dean and head of school of the School of Clinical Medicine in UKZN. What I'm proud of, I'm one of the first Black dermatologists in South Africa, and I've trained about 40 more other dermatologists. Been awarded the Maria Duran Award from the International Society of Dermatology for the work that I've done in South Africa for dermatology. I'm also the president of the African Society of Women's Dermatology. Pigmentation disorders are amongst the top 5 skin conditions that we see in dermatology clinics. In a study that was conducted in our institution at UKZN, pigmentation disorders rated number 4 in terms of the top 5 conditions that we saw. And the prevalence was about 6%. This condition occurs after inflammation of the skin, irrespective of the cause. It could be related to acne or pimples. It could be secondary to eczema, psoriasis, lichen planus, and other conditions. The second group is patients who have melasma. Melasma is a form of skin pigmentation which occurs mainly in women, but rarely in men, and it occurs on the face, and it is aggravated by sun exposure and contraceptives. In particular in South Africa, because it's hot and the sun is very strong, patients tend to be prone to this condition, and it tends to get worse after sun exposure. What I found interesting about this molecule and the work that has been done is that most products that are used for hyperpigmentation have been used on mushroom tyrosine. However, Thiamidol, to my knowledge, is the only product that has been used on human tyrosine to see whether it inhibits tyrosinase. I was delighted to be invited to be part of a clinical study that was going to evaluate the use of Thiamidol in users with hyperpigmentation, that is, users who have acne and post-inflammatory hyperpigmentation. This was particularly interesting for me because most clinical studies focus on the West, and some of them do not extend to involve users in Africa or South Africa. So the aim of the study was to assess the impact or the effect of a thiamidol-containing compound to see whether it has an impact on pigmentation related to acne, that is post-inflammatory hyperpigmentation. 90% of the users showed remarkable clinical improvement in the pigmentation. This was based on 3 parameters. Firstly, the self-evaluation. The users were happy with the impact of Thiamidol on post-inflammatory hyperpigmentation. The clinical assessment by myself as a dermatologist showed, again, 90% improvement in the evaluation of the impact of Thiamidol. So after 3 months of treatment, the conclusion was that the Thiamidol-containing compound showed clinical improvement of about 90%, meaning that it showed that it can visibly reduce pigmentation, or what we call dark marks, effectively. So at the end of the study, the users were quite happy with the outcome because they felt that they do not have to use a makeup or camouflage to hide the dark marks. They also felt that their self-esteem had improved and they were confident to go out there and face the world.